Hi guys. Okay, so I don't know, something just came to my mind and I was just thinking of how can the Nigerian healthcare sector be better? Like what is happening to our insurance? Is there a way the insurance can do better? And then I was thinking like, how about the manpower stuff? And I was like, probably we just are going to have to churn out more doctors. Okay, fine. How do we retain them? Like how do we make life easier for them? Okay, they are coming into the workforce. How do we make their life way easier? You know, and I thought of mm, and the first thing that came to my mind was like, okay, we have AI now, right? Why don't a lot of us are using AMR, so like why don't you like have when you're interacting with the patient, fine, of course you have to think of all the privacy has to be maintained, but like an in-house built AI algorithm that transcribes for you automatically as you're having this conversation with the patient, it just transcribes your information for you, and you can just dictate to the AI to transcribe your plan, your treatment plan, and everything. I feel it's gonna might save some time and then have more time to actually interact with the patient and to facing your screen. I think it will also improve. Other thing, you are able to spend more time interacting with the patient, examining the patient, and once you're done, you're with the patient, you're practically done with the patient, and then on to the next patient, and everything is transcribed, and all you have to do is next patient kind of stuff. I think it might make things a lot easier for people in the workforce. And then I was thinking, does that really solve things like that? Then I thought of, okay, how about if we had like specialized hospitals, like specialized kind of like maybe a hospital would have like two two places like separate. Like for instance, there'll be, let's say we have a department, it has a number of consultants, we divide the consultants into two. um, a particular consultant would, or a group of consultants will be on the clinic shift, yeah, in a particular building. So all patients that are outpatients, you're seeing them like nearly every day there, or like there'll be a clinic kind of stuff where patients, clinic, this place, you want to be admitted. Okay, a patient is coming to clinic or it's in bad condition, ambulances takes them to this particular building that only handles um inpatients and emergencies. So like, and everybody who is there is knows that for this week I am seeing patients, inpatients basically throughout this week, and patients are attended to. It's not like we're in the clinic, we don't have time to see the patient on the ward, or people on the ward are clueless on what to do. I don't know, like there's sometimes that these kind of things kind of happen around here. So I'm like, maybe that can be like a kind of solution where people on the wards are also, I know in other clients they're probably called internists or people that are always on the ward or critical care, but we don't kind of have that here. So it would be a good idea if there's someone, a specialist, always on the ward. Of course, there are doctors always on the ward, but like the nurses are always looking for some. I don't know, like I don't know. I have some issues um where ugh, the breath. I just want the patient to have somebody by their side and the person not overwhelmed, right? If the person knows that they are only on the ward, they know they're only on the ward. They don't have to think about, oh, I have to go to the clinic. I have to go do whatever. They are stationed on the ward, and when they are done, like normal working hours, somebody else comes to take over from them. Like that is what I would like, people to be alive and not dying and thinking of so many things over and over again. Fine, patients are some patients will be for emergency surgeries. Fine, the person stationed on the ward can help prep the patient, but that person is not going to be going to the theater. with them. There's gonna be some people else on that kind of duty. I don't know. It's just an imaginative thing, but like I want the patients to have the best services rendered to them by people who are not exhausted out of their mind. And I would love an enabling environment. If you want the best services, we have to cater for the people who are rendering the service. Not only that, we have to ensure the consumables to render the service are readily available. Now I'm talking about health insurance. Like there's got to be a way where we like I was in school and I remember them teaching us about this revolving system where if there's a seed money, you know, an endowment, and then you use it to, buy pharmaceutical, buy consumables. When patient come, when they use it, let's say for each of their services, there's an amount you get for consultation and stuff like that. Those amounts should be able to, run back, like if you're collecting this money for this services for the use of this product, okay, we've gotten this money, it should be enough for us to go get those stuff, like restock, and still have a little bit left, so like we will be self-sufficient. But from what I've heard, it doesn't seem to work. I don't know why that can't work. Why can't that work? It's supposed to be. I can understand inflation, but it's not inflation. The money just doesn't come back for it to be real. It just kind of goes, and then a different kind of money. The government has to kind of pay another form of money. There's gotta be a way. Anyway, to make life easier for the people who are in this service, I think AI that transcribes is gonna be amazing, and I feel like to also have a better patient interaction, it would be nice to have like admins, admins that their work is to like follow up on the patient, like call the patient, like if the patient wanted to you know frequently asked question, this admin will have some of this information. So the doctor who's exhausted out of his mind will not be have to be called again when he's not on duty. You know, I don't know, like it would be more like, okay, there's an admin always stationed in the hospital who gets these calls. There will be a group of them for different departments, and they'll be able to answer frequently asked questions. And if they are like, oh, they know what to pointers say, hey, patient, start coming to the emergency. You can't be asking this question. You need to be in the hospital. And instead of, just allow the doctor who wants to. Uh, and then, of course, we also have the nurses in all of this. And I feel like sometimes I feel bad for them because they're like in the wards, they've seen the patient. Um, and the doctor is in the theater and they need help with something, and they're distraught and they're waiting endlessly. Everybody's waiting and doing all kind of stuff because the doctor cannot be split into two. If there was somebody who's always on the ward, I know in some places it might, but anyway, if your place doesn't have that kind of arrangement, I think they should. Of course, I'm just talking in hypothetically that you have enough manpower. Because if you don't have enough manpower, I don't know, like the Nigerian health system is on a lifeline. Like every single day, every single month, pe- healthcare workers in Nigeria are leaving because they're tired and because they want to feel good. They want to feel appreciated. They they want to feel fulfilled in what they're doing. Like it doesn't make sense to be in a place and you see some patient die for things you know they could have survived for if they could have afforded the treatment, if um if some things were in place and all this kind of stuff. And I can understand them. But then for the people who are still available so that they don't keep dropping as flies and dying because of stress. We need to put some systems in place. Okay, I wish this can solve the problem, but I know there's still so many problems to be solved. hmm I think of some other idea I can share here. I don't know if it's gonna help anyway, but for change to occur, we have to start discussing it. Mm. Maybe somebody is gonna listen to this and it's gonna be the one who's gonna affect the change because I'm right now clueless on how to affect that. But that AI that can transcribe is giving me, yes, I need that in my life. Let's think about it. Over.